Hello, thank you so much for joining Strong to the Bone. My name is Abby Sauber, and I am a physical therapist at Restore Motion. I hope you learned something new today that will protect your bones and keep you moving. The following presentation is for educational purposes only, and you should consult a healthcare professional for individualized medical advice, diagnosis, and treatment. Restore Motion is a physical therapy clinic in Rockville, Maryland, and we specialize in orthopedic and neurologic dysfunction, sports and performing arts injuries, pelvic health, and pain management. And today we're going to talk about bone health, so let's get started. Why do bones matter? They are the mechanical basis for movement. They protect internal organs like our brain and lungs. They store minerals like calcium and phosphorus, and they play a role in the formation of blood cells. Here we have a graph showing us how bone mass changes throughout the lifespan. We can see from early childhood to early adulthood, bone mass increases rapidly. And then at about 25 to 30 years old, we reach peak bone mass, meaning the maximum strength and density of our bones. But after peak bone mass, we notice a decline in bone mass with age. But you can notice the bone mass decreases at a much more rapid rate in people with a uterus and ovaries due to menopause and the decreasing estrogen levels. And this loss of bone tissue can lead to the development of a bone disease called osteopenia, or in more severe cases, osteoporosis. Osteoporosis is a condition in which bone thins, resulting in decreased density and strength. In Latin, it means porous bone. Approximately 500 million men and women worldwide may be affected. Osteoporosis is a serious bone disease because it increases the risk of fragility fractures. Fragility fractures occur from minor forces such as a fall from standing height or even things like coughing and sneezing. Bone fractures due to osteoporosis are extremely common, impacting 1 in 3 women and 1 in 5 men worldwide. Worldwide, osteoporosis causes more than 8.9 million fractures annually, resulting in an osteoporotic fracture every 3 seconds. And even though this disease is both common and serious, it is extremely underdiagnosed and undertreated because many times it's asymptomatic until the first fracture. And 80% of patients are not diagnosed with osteoporosis even after sustaining a fragility fracture. The most common sites for osteoporotic fractures are in the spine, hip, wrist, humerus, or pelvis. Most fractures in the spine occur due to osteoporosis are called compression fractures. Compression fractures are small breaks or cracks in the vertebrae, the bones that make up your spine. You can see in both pictures that the front portion of the vertebrae is compressed and fractured, and over time these breaks can cause the spine to collapse, creating a forward bent posture. Signs and symptoms of a compression fracture include pain that increases with standing and walking and decreases when lying down, loss of height, a curved, stooped shape to your spine, and difficulty bending or twisting your body. So now let's look at the factors affecting osteoporosis. Factors that we cannot change that increase our chances of low bone mineral density include advancing age, the female sex, Caucasian and Asian races, having low body mass, having a family history, and having certain diseases like rheumatoid arthritis. Risk factors we can modify include sedentary lifestyle, smoking, excessive alcohol intake, long-term use of certain medications such as corticosteroids, diets low in vitamin D and calcium, and sex hormone deficiencies. So how do we diagnose osteoporosis? The gold standard for diagnosis is getting a DEXA scan, which can measure bone mineral density. DEXA scans are considered very safe as they use much lower levels of radiation than standard X-rays. The results of a DEXA scan are presented as T-scores, which represent the difference between your bone density from the average bone density of healthy young adults. A T-score of -1 or greater is considered normal. A score of -1 between -1 and -2.5 is considered low bone mass or osteopenia. A score of -2.5 and below is considered osteoporosis, and a score of -2.5 and below with a history of a fragility fracture is considered severe osteoporosis. So here we have a DEXA sample report of the spine. On the left of the screen, we have an image of the lumbar vertebrae L1 to L4. And in the table, they report the bone mineral density of each segment in the lumbar spine, and then the associated T-score, which they also represent in a colorful graph. Now here we have a useful online tool to calculate your risk for osteoporosis called FRAX, which stands for Fracture Risk Assessment Tool. The assessment includes a quick and simple questionnaire to calculate the 10-year probability of a major osteoporotic fracture. This information is helpful to share with a healthcare provider to determine a proper plan of care. Next, we will discuss how to prevent bone loss associated with aging. Prevention includes decreasing fall risk, addressing posture, resistance training, weight-bearing activities, a healthy diet, increasing vitamin D and calcium intake, avoiding harmful habits such as smoking, and asking a healthcare provider about hormone replacement therapy. But let's talk about decreasing fall risk. Fall prevention is absolutely critical because fall prevention is fracture prevention. So many different factors can increase fall risk, including impaired balance, using multiple medications, home hazards like having pets, clutter or throw rugs, having low blood pressure, especially when changing positions, having improper footwear or decreased sensation in the feet, or having impaired vision, like having an old eyewear prescription or walking around at night. So this diagram shows the different components of balance. Balance involves musculoskeletal components, neuromuscular strategies, and individual sensory systems. Musculoskeletal components to balance relate to things like our muscles, tendons, ligaments, and joints. When our balance is challenged, like being shoved at a crowded store or at a concert, we need to regain stability by using the joints, muscles in our ankles, hips, and trunk to keep upright. So by incorporating exercises like calf stretches and glute and core work, we can prevent falls. The different sensory systems send our brain information to help us stay upright. 70% of information comes from the somatosensory system, which gives us information about where our body is in space through muscle and joint stimulation. 20% of information comes from the vestibular system, or the inner ear, and 10% of information comes from the visual system, or what we see with our eyes. However, most people rely on the visual system to stay balanced, even though we get the least amount of information through our eyes. This is why so many of us lose our balance when we're asked to close our eyes. Therefore, one of the most effective ways to improve our balance is to work on our joints and our muscles. The last aspect of balance is neuromuscular strategies, such as our reflexes and our stepping response. Taking a step or steps might be necessary to reestablish a new base of support to prevent falling. Agility training is extremely important for our reflexes and stepping response because it works on our ability to start, stop, and change directions quickly. As we age, we lose speed and power much more quickly than we lose strength and endurance. Therefore, fall prevention programs must include quick movements such as side shuffles or jumps, crossovers or karaoke, and high knees, fast feet. These exercises can include an agility ladder as pictured. Other examples of balance exercises include standing with a narrow base of support or standing in tandem. Once you are stable and comfortable, it is important to progress with eyes closed so you're not dependent on the visual system. When we close our eyes, we help isolate and strengthen our proprioception and awareness of space with our muscles and joints. Another important aspect of prevention is posture. Most of our work and activities of daily living are taking place in front of our body. This means we are usually leaning or bending forward, which results in more compression and less elongation in our spine. It also means the muscles in the front of our bodies become shortened and tight, and the muscles in the back of our body become lengthened and weak. So again, as we age, we see this forward head posture, rounded shoulders, a kyphotic spine, a loss in height, and a forward flexed posture. But to maintain upright posture, we need to focus on exercises that extend and elongate the spine, lengthen the arms and legs, and strengthen the shoulder blades and the trunk muscles. So this slide shows the difference between core exercises that use flexion versus extension. In the photos on the left, people are doing exercises like crunches and Russian twists by flexing and rotating their spine. While in the photos on the right, they are doing exercises such as bird dogs or Supermans by extending and elongating their spine and extremities. This will successfully strengthen the core and back without compressing the spine. Whereas if we look here, fracture risk is higher with flexion-based exercises because flexion exercises compress the front of the vertebrae. And we can see that compression in the picture on the right with the arrows and the fracture occurring at the front of the vertebral body. Okay. So posterior chain strengthening means strengthening of the muscles in the back of our body to maintain a long spine. So examples of posterior chain strengthening include calf raises, bridges, squats, rows, and deadlifts. Other ways of preventing bone loss are resistance or strength training. Strength training increases muscle strength by making your muscles work against a weight or force. Forces can be body weight, free weights, weight machines, or resistance bands. Research has shown that resistance training increases specific site bone density, especially at the neck of the femur and at the lumbar spine. But it's recommended that you train for at least 3 times per week for a year to achieve this increase in bone density. Here we see a study in 2013 on postmenopausal women with osteoporosis or osteopenia that showed a significant increase in bone mineral density at the lumbar spine and femoral neck after using a weighted leg press for 3 months. Participants used the leg press machine 3 times a week and completed 6, 8 to 12 reps at 50 to 90% of their 1 rep max. Next, we will talk about how weight-bearing activities and exercise can prevent bone loss. Weight-bearing is an activity that one performs on one or both feet. It requires that one carry body weight on at least one lower extremity, and weight-bearing is an activity that the skeletal system does against gravity. Based on current research, walking alone is not sufficient to modify the loss of bone mineral density associated with osteoporosis. However, high-intensity walking interspersed with jogging, climbing scales, and stepping can limit the reduction of bone mineral density with aging. Lastly, we will talk about how increasing vitamin D and calcium can reduce bone loss. A daily intake of 1,000 to 1,200 milligrams of calcium is recommended. For women with low dietary intake, supplements of 600 milligrams daily may be useful. And for reference, a dairy-free diet usually only contains about 300 milligrams of calcium. And then if we look at vitamin D, a daily intake of 1,000 to 2,000 international units daily are recommended. As always, though, please consult your doctor or nutritional professional for the best way for you to get your dietary supplementation, because things like too much calcium can cause many side effects, including heart arrhythmias and kidney stones. Here we have foods that are rich in calcium. Some examples are sardines, milk, yogurt, brick cheese, kale, almonds, tempeh and tofu prepared with calcium, collard greens, and broccoli. And then here we have foods rich in vitamin D, including eggs, orange juice, salmon, mushrooms, cereal fortified with vitamin D. Lastly, we will cover the medical management of osteoporosis. The main medications used to treat osteoporosis are raloxifene, biphosphonates, and osteoanabolic agents. Raloxifene is an anti-estrogen drug used for women with osteoporosis at high risk for breast cancer, but not for hip fracture. Biphosphonates are the most commonly prescribed drugs to treat osteoporosis. They work by slowing the activity of bone-dissolving and bone-forming cells. They increase bone density by 4 to 10% over 3 years and significantly decrease the risk of spine, hip, and other fractures. And then finally, we have osteoanabolic agents, which work by stimulating new bone formation and rebuilding bone structure. The drug is more effective than biphosphonates at increasing bone density and reducing fractures, and they are recommended for patients at a very high risk for fracture. So our big take-home messages are to take action now and to get screened and assessed for osteoporosis. To decrease fall and fracture risk by getting strong, improving balance, and increasing agility, and to make exercise prescription a part of your plan. Thank you so much for listening, and we hope to see you at our 6-week strength challenge, Strong to the Bone.